Okay, so I'm not sure Justin needs any introduction. Justin is the person that I went to for all my training when I was doing my PhD, which is like a million years ago. But for those of you who do not know Justin, and I don't think that's anyone in this audience, but Justin is the director for the Centre for Advancement in Realist Evaluation and Synthesis, or as known to all of us, CARES. He's also a visiting professor at the University of the West of England, and he's previously served at the University of Liverpool, at the University of Surrey, and the University of Hull. And he's involved in numerous, over here in the UK, numerous NIHR funded research projects in health service delivery as a co-investigator. And Justin runs consults a number of research projects as well. And for all of you who are not familiar, Justin also runs training on realist methodology as well for students and professionals throughout the year. And I will pop the address for your website in the chat, Justin, as well, so that people can go on. I think your courses for May Beyond are all live as well, aren't they? I think I've
Yes.
seen that.
Yeah.
Yeah.
Yeah, that's right. Yeah.
So if
So,
anyone wants to
yeah.
follow up, um,
Yeah.
then follow this. I'm just going to put that in now. You can follow this link in the chat to Justin's courses. So without
That's
further
great.
ado, I'm going to pass over to you.
Thanks. Thank you, Joe. Thanks for the invitation. It's a pleasure to be here. I'm looking forward to discussing this innovation for realist synthesis. And just to say hi to everybody, I look through all the names and I feel like maybe I've met almost everybody here, which is a really nice feeling as well. So great. So as I present the material, you can put any questions or comments in the chat, and we can have a little discussion at the end. So the title of this presentation is Reverse Chronology, Quota Record Screening for Realist Synthesis. It's a long title, but if you break it down into just three areas, reverse chronology, quota, record screening. It's a way to approach record screening in realist synthesis that can change the overall design of your realist synthesis. And we have trialed this in a number of projects, and the number is growing now. So I have experience working with this with at least 4 projects now, maybe 5 projects. And so every time we do it, there's always reflections and learnings along the way. So I just want to share what the technique is and what the potential benefits and limitations are, and then we could have a discussion. So reverse chronology quota record screening. So the good news is it's actually a very simple concept, okay? So when you do a realist synthesis, you would take the results from your bibliographic database searches and you order them in reverse chronology according to date of publication. And then you establish quota categories and number limits prior to screening the database records. So you do database searches. So you go to the database, the databases. You put in your keywords. So you create a search string. Some call it a search narrative. And that gives you results. That we call that a database record library. The results are going to be a certain number of records. It could be 500, it could be 15,000, right? And maybe all of you know this yourself from experience working in for evidence syntheses, right? You could have many, many records. So in this technique, what we do is we would order them in reverse chronology. Now, they're not always ordered in reverse chronology. In fact, a very common way that they're ordered is according to relevance, which is determined through the automated uh, um, uh, application that you're using. So, for example, if you're using Covidence or Ryan, the software can order the records according to relevance, which would likely be in relation to the number of hits between the search string and the keywords that are popping out through the citations. So this is different in that we are prioritizing the most recent publications and ordering them that way. So then you set numbers based on the number of months you have for the review and also categories if you need. So you may have a singular category where you're screening into one category, or you might divide it up into multiple categories, and I'll talk more about that. And then you set a limit. Let's say you decide that, well, I've got 6 months to do this review, so I'm going to set the limit to 30 papers. So you screen in reverse chronology backwards to the most recent 30 papers, and you stop. Even though there's more papers to screen and there's more possible papers out there that are eligible, you stop, you retrieve those papers, you read them, and then when you read them, you might determine, well, some of them are not that relevant, so you eliminate them. That reduces your numbers, and you refill you go back to the databases to refill to the quota. So let's say you have set a quota for 30 papers. You download 30 papers, you read them. 5 of those papers turned out to be actually not the right thing. You thought they could be relevant, but they weren't relevant for some reason. So now you only have 25 papers. So you go back and you keep screening from the last set record that you screened, and you screen until you hit the quota, which would be back to 30. And so then you have 30 papers, and you can proceed then to use those papers to create an analysis where you might start to do some data extractions and create CMO configurations, and then you go back to screening in a second phase. So screening can be conducted in stages with adaptations based on learnings from early analysis and stakeholder input. And this is interesting. So instead of doing an exhaustive screen, so exhaustive record screening, which is essentially screening the entirety of a database record library from a search first, and then pooling those and then funneling those papers down into a smaller set, narrowing the criteria over time to get to your final stage, through the Prisma diagram, as it usually shows how you start with thousands and then you end up with like 15 papers. Here, what you do is you just simply, not simply, but you do a one round where you look at the papers that you've retrieved. You build an analysis. You then present the findings to your stakeholders at some early, like preliminary stakeholder consultation events, and you see what direction your stakeholders will take you. So your team could be your team members, it could be PPI, patient and public involvement, it could be practitioner stakeholders. And then they may guide you. So they may say, this is really on track, or, I don't think this is where we want to go. Or they might say, out of all of the things you've presented, here are the priority areas that we see. And then you go back to the database screening to screen more. Now, when you go back for a second phase, there is the option to continue screening in the way you did in the first phase, or do targeted searches within the database record library. So I hope that's clear, but I can unpack that a bit further. But generally speaking, what I'm conveying here is building a more iterative approach to the design of your realist synthesis that could be more in line with realist methodology. And then another important point is that you should pair reverse chronology quota screening with other strategies, such as informal searches. You could do informal, Google searches, or backward citation tracking, in which you find seminal papers or important papers through the papers that you did retain, and also expert solicitation, where you reach out to your experts in your network or in your team and you ask for recommendations for papers. And that's a way to get important papers that you may not retrieve through the database screening, because you are screening to quotas and you're doing it in reverse chronology. So you have a mix of strategies working together to get you to a retained set of papers that you can use for your realist synthesis. And this is particularly useful for short time frames. If you have only 6 to 12 months to do a realist synthesis, it may it may be beneficial to do it this way. And I think Sarosh you are on unmute. So anybody that's on unmute, if you could just mute your microphones. Thank you. And so here's some points to explain the rationale for the approach. So study selection for a realist synthesis is challenging because causal insights needed to build context mechanism outcome configurations cannot be determined well through database record screening. So at the stage of reading the record, which is the citation, which is the title, the abstract, the author, the journal, it's hard to know whether that paper is going to contain causal insights that will help you explain your program, the intervention you are investigating. You might be able to determine relevance just by reading the title, so it matches to your research questions, right? But not richness, which is around the causal mechanisms or the CMO, the context mechanism outcome configuration. So you could spend a lot of time belaboring decisions at the citation stage when you're reading database records. You could belabor these decisions without really knowing whether they will be useful or not. And you really have to read studies anyway to know, right? And so realist synthesis, another point is that realist synthesis, realist methodology uses a configurational approach. And this may include assembling data segments across a set of retained studies for CMO building. So you might have context from one paper, mechanism from another paper, outcome from another paper, and you in some cases, not always, but in some cases that happens where you have the CMO coming from different parts of the data set in realist synthesis, we're talking about the retained studies, right? That's what when I say data set, I'm talking about all your retained studies. You may have the CMO bits coming from different parts. And so this configurational approach may mean that it is more beneficial to have a diverse sample in your literature rather than a very homogeneous sample. And again, let me try to unpack that in a little bit. So the next point is that a heterogeneous sample of papers in and around the study area may be more useful than a homogeneous sample that is exactly matched to the study area. Like, for example, if you if you're studying a particular intervention, you could approach the database screening by saying, right, I want to gather all the studies that research this intervention. That makes a lot of sense, right? To look at. Now, I'll give you an example. Years ago, I worked with a group that was studying back to work rehabilitation programming. So somebody is a worker, they get injured at work, and then they're off work, and now they're on disability insurance and so on. And so this program, their programming was all about how to get people who've had injuries back into the workplace by using like customized, like ergonomic technologies and other things, co-production to get them to feel comfortable coming back into the workplace. So I trained this team who were developing a model to support back to work rehabilitation. They were all occupational therapists, I think. And the lead had invited the world leaders in this area to like a few days meeting. And we talked about doing the realist synthesis. And one of the members said, "Well, we know all of the randomized controlled trials in this area. So all of us were involved in those trials. We all know them. There's like 15 of them. Why don't we use those 15 trials as our sample for our realist synthesis? Because after all, that will be the highest quality research out there. We can then synthesize that." So when they made that suggestion, I actually gently pushed back a bit and said, you want to be careful to not only use exactly matched papers because there is a risk that they are thin on causal extrapolations and causal insights, especially being randomized controlled trials where the focus is on counterfactual study design, the focus is on outcomes, maybe not so much on mechanisms. And so it would be better to have a range of papers, including papers around the context. There could be papers around employment policies, papers on organizational context, papers on organizational leadership that could have an impact, right? Which is outside of the specific scope they're studying, but you can start to see how um, there are layers of the intervention and the context of the intervention that you'd want to start to build in. And so you might have some papers that are tangentially relevant. They're not exactly matched, but they are tangentially relevant that you could explore and create extrapolations to build your CMO configurations. So that's a more innovative, creative, exploratory approach to using realist synthesis. You don't have to do it that way. But I think realist synthesis works for those exploratory ways of working, and you might be breaking new ground. You might be doing something that is really brand new and not just recycling the same messaging that we get. So we're on this hamster wheel of research. Nothing against hamsters, but the hamster wheel is just saying the same thing over and over and over years. And so are we actually breaking new ground? So breaking new ground is doing something different and bringing in a data set that actually is maybe surprising or unconventional, but could actually spur creative thinking to see the mechanisms, to see the CMO configurations. And another point is that when there are too many eligible papers, reviewers may decide to narrow the inclusion criteria for data management purposes, even if a diverse and heterogeneous sample works better for realist thinking. So this is another issue, and you may have experienced this, that you do the database search, the database record library that is retrieved is 15,000 plus citations that you could screen, and not all of those would be relevant, but let's say out of all of those, you have 2,000 relevant papers. Then even though they're all eligible, they're relevant to your research questions, you feel compelled to modify your research questions just to get through it and make it manageable. And that's, in my opinion, not a good reason to modify your scope or modify your research questions, because maybe your research questions are valid as they are, and narrowing the scope, you're losing some richness that could be beneficial. So this is a way to keep the scope broad and also manageable at the same time. So remember that the realist synthesis is a configurational approach. Like if you contrast that to quantitative evidence synthesis, what we may call a systematic review, the logic of analysis is aggregation. And so when you're aggregating from a statistical perspective, you want a large sample size. So the benefit here is to increase the sample size by including multiple primary studies and all the data within multiple primary studies to create a potentially new statistically significant result. And in this case, homogeneity in the study selection is beneficial to attain a large sample of data for statistical analysis, right? And so we don't want to simply mimic systematic review for realist synthesis. Now, let me be clear. You could still work towards homogeneity in your study sample for realist synthesis, and maybe it will be successful, and that's great. You might need a bit more time to do it, and that's fine. But you also have, a different logic here, which is configuration, and then diversity in study selection might be beneficial to explore causal understanding with a range of evidence, diverse evidence. So we're not looking to aggregate the data. We're looking to configure it like pieces of a puzzle. So if I use that metaphor, it's like puzzle pieces. And so the C from here, the M from there, that kind of thing, that is configurational. And so homogeneity in that sense may not always be the right thing. So you all are familiar with this, I think, the CMO configuration, where you have the context as the environment, and then the intervention. If you're doing CMOs to evaluate an intervention, then you have the mechanism as the underlying causal force of the intervention strategy, which is how people respond to resources, and then you have outcomes, right? And so with different types of studies, there will be a different focus, right? If you gather randomized controlled trials, there will be a focus on outcomes data. Qualitative research will have more to say about mechanisms and context. You'll find context in both qualitative and quantitative papers, especially in the introductory sections of those papers. You'll get a lot of detail around context. A lot of the times the context is described as the deficit, the problem that is being addressed, but there may be other ways to think of context, not only in the negative, there are also positives about context. But in any case, you will find these in all parts of a research paper, and not only research papers, right? So you can also include commentaries, letters to the editor, editorials, social media, blogs, reports, so unpublished reports or government documents and so on. All of that literature is eligible for a realist synthesis because it has potential richness and diversity that you can use. So in doing that, so this configurational approach also means that you, as the realist reviewer, are going to be engaged in extrapolations and new theorizing through your CMO configuring. So the CMO configuring is not strictly summative, right? We're not just summarizing what the evidence is saying. We are putting it together. In putting it together, we are building our new theories. If I'm saying the C from this paper, the M from that paper, and I'm going to put that together, that's my theory. That's my thinking. I think this would work. It's tentative, but let's test this. Let's check with stakeholders. Does this make sense? Which does this resonate, and so on. So we need to kind of stay connected to our stakeholder groups throughout the process when we do the configurational approach. Okay, here are some uses of reverse chronology quota screening. So one is that the time frame to complete the synthesis is short. So if it's a rapid review, rapid meaning, okay, 3 months. All right, I said it, but I don't recommend it. 3 months. You could do 3 months, 6 months, 9 months. That's all qualifies as rapid realist review. Once you get past a year, so if you have like say 15, 18 months, I wouldn't call that a rapid realist synthesis. I would call that just a regular realist synthesis. But the time frame when short RCQ is very useful for that. The scope of inquiry is not fully defined, so you're not entirely sure um, what you are studying, or maybe you have an idea for a program or an programmatic area that is still at a developmental stage. And so the the realist synthesis you do is truly exploratory. You're not looking for pre-existing research in evaluating this intervention because the intervention has never been done before, and you are the one going to do this intervention for the first time. So then you can explore more broadly, right? Or the intervention is a newly implemented innovation and lacks a trail of research to synthesize. So, okay, so the intervention has been developed, it is being implemented, but when you go to the literature, you don't find much because it's new and it takes time for the research to start to appear. Now, there may be parallel um, interventions that you can pull from, which is another point we can talk about. Another reason why RCQ could work is if you don't have this trail of research to synthesize, you could switch over to a parallel base of evidence to synthesize. Like I have so many examples of this kind of thing. Like, for example, if you're looking at, well-being interventions for, um, the police force, and you find that, let's just say hypothetically, there's not that much out there on well-being interventions for that group. Well, maybe there's a lot of well-being interventions for other groups, emergency service personnel or military personnel or something like that, in which they have a similar work experience in some ways. I mean, there's differences as well, but there are some commonalities. And so you could go to a parallel sector and investigate interventions in that sector to then bring over to, to explore extrapolations for your sector. Again, reverse chronology quota screening can work for that because you can get to the most recent um, uh, papers in an area and create extrapolations fairly quickly. Um, Another issue, the availability of suitable literature is beyond the screening capacity of the reviewer. So you have, say, 5,000 eligible studies. How do you decide which ones? So I've talked about this, the risk of creating narrowing criteria for data management purposes, which is not really in line with your research agenda, what you really want to do, or that the availability of literature is sparse, and reviewers seek to extrapolate insights from other areas. So this is what I was just saying, finding alternate data sources or a mix of data sources where you gather from different contexts. Okay, so that's one example, and this is in the paper. So we published the paper. You may have seen it. It's just come out. So the reference is at the bottom. So this is just a diagram that shows the steps. Okay, so step one is determine the quota size for the groups and subgroups of papers. So determine the quota size and the categories that you'd want to use. And then step two is to retrieve and appraise the full text papers and then refill the quotas when papers are eliminated on full text read. Step three is to produce the preliminary realist analysis and present early findings to stakeholders, and then return to screening to continue refilling quotas and subsequent specialized data retrieval. And then finally, combine the screening, RCQ screening, with other literature identification approaches, including hand searching and expert solicitation. So let me be clear that there will be a section of your database record library that you do not screen. And so you have to be comfortable with that. And that's, there's basically two ways of doing it, because what we call the screening everything, we call it exhaustive record screening. So you're screening the entire data record library, which is typically what is done. And it's, it's potentially beneficial because you can capture papers that are there, in the library, older papers that are relevant. But once you start getting back in date range, so you go to the oldest record and you start retrieving papers that are from 2014, 2012, 2010, 2009. I mean, we're in a totally different era now than we were back then. The reality of, society has changed, healthcare has changed, technology has changed. The pandemic was a rupture. And so there's pre and post pandemic realities. And so there is something to be said about, working with very old papers. And now working with the conceptualizations in old papers can be very beneficial, but working with research data from very old papers may be questionable because you are looking for CMO, context mechanism outcome. And in the realist approach, we would obviously want to find the most relevant contexts to synthesize, and the most relevant context will be the most contemporaneous, the most recent context. So the most recent contexts are also going to show you most recent innovations and what's going on currently, which can be potentially more relevant. And if you synthesize the most recent papers, then you're also going to be creating a realist synthesis with papers that have never been used in other reviews. So it's possible that if you use older papers, they will have been synthesized in other reviews as well. So there are just these different ways to think about it. All right, I want to show you a case example, and I have a few examples, but I'm choosing this one. This is a project we worked on a few years ago. It's called Shared Decision Making, and deprescribing to support antithrombotic therapy discontinuance for persons with cancer in their last phase of life, Serenity Project. Now, very specific, right? And research is becoming very specific, right? We've got general research, and as things progress, we get into very specific ideas, right? And this idea is that, when somebody receives a cancer diagnosis, they often get put on antithrombotic therapies because cancer and cancer treatments can cause blood clots. So people are on antithrombotic therapy, but the issue is as they're approaching the last phase of life, through physiological changes and prolonged usage of antithrombotic therapy, there's also a risk of what clinicians call catastrophic bleeding event, where they could really have a very serious brain bleed and have a serious condition at the end of life. And so this can be hugely distressing for the person and the family and the healthcare staff. So, but the issue is that it's not entirely clear when you would want to remove the medication. So and this is where the shared decision making part comes into play, because what the lead investigators and the team in this research, who are clinicians who've worked in this area, so they know what's going on, what needs to be done. The idea is that you want to talk to patients about it, and you want to let them know that, look, these are the risks, these are the benefits of taking this medication. We'd want to remove this medication at some point because maybe the risks outweigh the benefits. But having that kind of conversation, especially in the last phase of life, it's a very sensitive conversation. A lot of doctors worry about that the patients will feel that the doctor's signaling this is the end, by saying we're going to take you off medications, makes it sound like we're taking you off your life support. So doctors worry about distressing patients by talking about deep prescribing. And also, not everybody knows when is the right time. What if you take somebody off medication and the next day they have an adverse event? So there's a lot of factors that go into prescribing inertia, what we call prescribing inertia. So now I gave you a little bit of background because I want to kind of show you the scenario. We had 12 months to do a realist synthesis, and we were interested in this question, but the reality was that there were no papers that we could find that were specific to shared decision making for deprescribing, for antithrombotic therapies, for cancer patients in the last phase of life. All of that specificity meant that we just couldn't find those exactly matched papers, which is a common experience. You may find yourself in the same experience. So the review investigated the shared decision-making approach to deprescribing in the context of palliative care. We had 12 months to do the review, but another point was that the review was only stage one of a 5-year study. And if your realist synthesis is part of a larger project, that's another reason to use RCQ, because you have more time to test your creative theories, the theories that you have built up and are, um, uh, exploring through your extrapolations. So in this case, there was 5 years, and so it's ongoing. And so it was year one. Now, when we did the database search, it retrieved 17,036 database records. This was initially retrieved through a search strategy across 10 databases, and there was no papers specific to the shared decision making for end of life. So what we decided to do was broaden the scope, and we searched for papers more generally for shared decision making palliative care and deprescribing in palliative care. So our initial quota, we had two categories here. One category was shared decision making, the other category was deprescribing. And we set it for 10 papers each. So we had 20 papers in the initial round and we intentionally kept it small because we wanted to make sure that if we read these papers, Are they giving us what we need? Will it help us build our theoretical model here that we're trying to build and so on? And now here's the interesting thing that paper retrieval took roughly 2 days. Okay, it just took us 2 days to get to 20 papers in reverse chronology that were hitting, shared decision making and deep prescribing. Um, and out of 17,000 plus records, right? So papers were read, analyzed using a rough analysis, and we built CMO configurations. We presented these to stakeholders in separate practitioner and PPI groups. Now, after stakeholder consultation, we researched the database record libraries for specific areas identified by the stakeholders: organizational factors affecting deprescribing, moral distress of healthcare workers. So in our practitioner consultation, in our practitioner meeting, when we shared the CMO configurations, um, one person said, well, you need to look at the organizational policies around pay structure affecting clinicians because deprescribing takes more time. So we need to have incentivizations from the organization that will support us to do this work because it takes a lot more time to do shared decision making. And so what was interesting was that because we had this database record library of 17,000 plus citations, we sub-searched in that library. We didn't go back to the main databases. We sub-searched in our existing library for uh, with keywords like organizational factors and deprescribing and moral distress and deprescribing. And we found additional papers. So we were able to customize the review based on feedback midway through our review, based on feedback from our stakeholders, and iterate the design that way. Now, just to be, put in your mind that if you use RCQ, the Prisma diagram that you create will need to modification. You won't be able to use Prisma in a standard way because that is it assumes that you're doing exhaustive record screening, that you start with 17,000, then you eliminate this many, then you eliminate that many, et cetera, et cetera. You go down this funneling kind of approach. Um, well, we didn't actually screen 17,000. So that's why we came up with a different way to depict the prisma. And this is from the paper. Um, so we had interesting discussions about this. People said that people on the team, the co-authors, some of them worried that because we didn't have a standard Prisma diagram, the reviewers, peer reviewers would object. But well, it published and nobody said anything. So this is our modified Prisma. But they did ask for a lot of detail to go into this diagram. So the peer reviewers asked for including all the databases. So it's a very detailed kind of table here, but this is the equivalent of a Prisma diagram for our reverse chronology quota screening. Um, we have the databases and also the number of citations. And then we said step A was to do the screening to 20, right? 10 papers on shared decision making, 10 papers on deprescribing. We also included the number of citations we did screen because to get to 20, we actually had to screen 230 records in reverse chronology. Then we presented that at the stakeholder event. So this is about stakeholder events. Then step B was another stage where we researched the database record library, including these terms, deprescribing, moral distress, end of life care, and ATT. So that's antithrombotic therapy deprescribing. And that we had to screen another 257 citations to retrieve an additional 36 papers. So that led us to 56. And then we had another 35 papers that were given to us by experts. So experts submitted papers that they thought would be relevant. So we had a total of 91 papers. And so our exclusions are here. So we had a standard kind of approach to the screening tool where we had inclusion criteria and exclusion criteria, which I'm not getting into because it's not necessary. But just to say that we did this in stages, okay? So so you can consider that, and that might give you some sense of reassurance as well, that you can actually start looking at papers before, even if you're not entirely sure about your scope, about whether these papers are going to be useful or not, because um, you can retrieve them fairly quickly and start reading. Once you start reading, things can fall into place. But I've done reviews where, especially back in the day, um, years ago, where we screened for, 8 months and we didn't actually start reading papers until like 6 or 8 months into it. And I think that's not a good idea because it can leave you feeling a bit anxious because you want to get anchored into the material to really know are we getting somewhere. So retrieving quickly quotas and then going forward from there could be helpful. This is just to show you, this was a figure from the paper that we published, um, from screening to analysis to findings. So this is like kind of an overarching findings. And even though we did reverse chronology quota screening and we just grabbed the most recent papers, there was so much richness in those papers. So we were able to identify cultural and societal factors, clinical context, organizational context that impacted on deprescribing and shared decision making. And then, of course, there's all the complexity of the interventions and the outcomes. Okay, so I'm not getting into that part of it because we're not going down that rabbit hole of this study. But just to show you that even with doing it this way, we were able to complete the study within the time frame. Okay, so I'd like to share 6 advantages and 3 disadvantages of reverse chronology quota record screening. And then a few concluding thoughts, and then we'll open it up to questions. Okay, so 6 advantages. The first advantage is that it improves the pacing of review stages and estimations of time required to completion. So setting quotas for screening can improve pacing of review activities across the timeline. This can inspire confidence of the reviewers that the review is going to be a manageable endeavor. And like I say, if you have more time, you can increase the number in your quota. If you have less time, you can decrease the numbers in your quotas. If you only have 3 months, maybe you would have your quota set for 15 papers. Even 15 papers that are rich, that are relevant and have richness, that can give you enough to really create a synthesis. Absolutely. All right, second point is that you may have increased time for data immersion and analysis. So reverse chronology quota screening shortens the time frame for selecting papers, which provides more time for data immersion and analysis, whereas an exhaustive approach to screening titles and abstracts in systematic review may take upwards of 1,000 hours. RCQ with broader inclusion criteria may require roughly 25 to 50 hours or less. It could even be less. So these are just estimates, but it depends. Okay, here is the third one. It reduces decision fatigue at screening stage. So screening large volumes of records for inclusions, for example, greater than 15,000 records, can feel unsettling for the screeners, given that important causal insights are often buried in papers and not knowable from title and abstracts reading. So RCQ reduces decision overlaboring for record screening and allows reviewers to move quickly to read full text papers for further adjudication. Now, this comes from my own personal experience, screening large volumes and feeling like, I don't know, this looks like a good paper, but I feel like I have to exclude it because there are other papers that are also good and we have to try to find some exclusion. So this pressure to exclude papers, even though you want to read them, you feel like I would like to get into that paper, but we just don't have the time, sort of thing. So it reduces that decision fatigue, that unsettled feeling like, how are we making the right decisions here? Fourth is improve representation of diversity in context and program architecture through multiple quota categories. So realist reviewers may be expected to provide analysis on how multiple interventions work for a variety of settings and demographic contexts. Quota categories can ensure that an adequate number of papers are retained for the different areas of importance, ensuring representation from underrepresented or under-researched areas. of importance. So I give you another example. So I worked on a project a few years ago called Care Under Pressure 2, which was looking at the causes and solutions to workplace mental ill health for nurses, paramedics, and midwives. The causes and the solutions for workplace mental ill health for nurses, paramedics, and midwives. So we did reverse chronology quota screening in that study where we set the quota categories for the three professions and we set it at 30. We had 24 months to do the study. And so we could expand it. So in our first round of database extractions, we looked for 30 papers looking at anything to do with mental health interventions and causes and interventions for nurses, 30, right? 30 for midwives and 30 for paramedics. And that way we had equal representation of the three professions in the study. Now, what was interesting was that in our database searching, there was an overabundance of papers for nurses, a, a sort of medium amount for midwives, and a dearth, and meaning a limited amount for paramedics. In fact, the paramedics literature was so limited that we couldn't even reach our quota from the database record library, meaning we couldn't get 30 papers from screening the library. So then we had to go to other sources. We did hand searching. We actually hand searched paramedic journals, and we found new papers there, paramedic journals that weren't indexed in the database in the databases. So there's another example, and that's an example that shows representation. You might have representation in terms of intervention type. So, for example, if you are studying dementia support worker programs, and you find that generally speaking, they are divided into home care and residential care. So you have dementia support workers working in residential care facilities. You have them also working in the home. Now you have the option in a realist synthesis to then just pick one or the other, right? Say, well, maybe I'll just go for the home care context instead of the residential care. Or you could do a realist synthesis with reverse chronology quota with the two categories, and you say, well, I'm going to look for 15 papers for home care and 15 papers for residential care. And there you have representation. And this is the interesting thing, that when you have diversity in your sample, it sometimes makes it easier to see the mechanisms and to see the importance of context. In other words, if you're only looking at home care, let's say you're looking at home care dementia support worker program, and you're trying to find the context that fits for your CMO, your context mechanism outcome. Having something to contrast that with can help you see it because it's there. It may be there, but it's sometimes hard to see the context, especially when it's like an everyday thing. It's normalized, it's routine, it's it's so well understood. It's almost hard to see it because it's too well understood. It's taken for granted. But when you contrast that with diverse contexts in your study sample, you might be able to start to see things that you didn't see before. So the way papers relate to each other is important in our analysis and building our CMO configurations. So diversity actually can be beneficial for that reason. All right, another advantage is that the retention of papers that are roughly relevant to the review topic supports new discovery and creative insights. Roughly relevant as opposed to exactly matched. And so roughly relevant means, well, you might have a paper that's just talking about the lived experience of a certain illness type, for example. Let's say in your review on dementia support worker programs, you have a paper, a qualitative research paper that is on um, the um, the experience of receiving a dementia diagnosis. And that paper will might go into the thoughts, the feelings of people who are the family and the person who's been diagnosed and how they feel. Now, if you match that with papers about the interventions around dementia support workers, that might be an interesting juxtaposition to match data around the qualitative piece around lived experience with the interventions and their functioning, even though that context piece, the qualitative paper on lived experience, doesn't say anything about dementia support worker interventions. Um, you might start to glue the pieces together. That's the configurational approach, putting the puzzle pieces together. And so roughly relevant papers might be actually beneficial. So quicker timeframes for screening allow for the inclusion of roughly relevant papers for an exploratory approach. Such papers with tangential relevance may have surprising richness that supports abductive theorizing, in other words, creative theorizing. Stakeholders and co-investigators involved in data analysis may find it conceptually refreshing to work beyond overly familiar, tried, and apparently true conclusions of previously well-known research on the topic and experience intellectual growth from diversity in study selection. And so remember going back to that example I told you about the back to work rehabilitation programming experts, and they were going there. One person had suggested we'll bring in all the randomized control trials that we all know of already, and we'll resynthesize that using the realist approach. You may not get that far. And alternatively, if these experts, these world-renowned, world-class experts, start reading papers that are slightly outside the scope of what they're familiar with, it might start to push them into more of a reflective space, a thoughtful space, a creative space, and the merger of new exposure to new thoughts, ideas in relation to existing expertise. That's a great place to be. That's, and talking about professional growth in the field and amongst academics, that's really important because academics become very specialized, very niche in a specific topic, and that's great. It's great to be an expert, but there is a drawback, right? And we to become an expert because your exposure to to ideas, content, data is becomes more and more narrowed. So this is a way to keep things broad and keep the exposure broad. So not all of that broad exposure is going to be directly useful, but having the opportunity to reflect in and around a study area can be beneficial. And then the last advantage here is that studying programs in most recent contexts, circumstances, and settings. So RCQ captures the most recently published papers reflecting most recent contexts and program innovations and theories, increasing the pragmatic utility of the findings for current challenges in the intervention area under scrutiny. So I personally find it reassuring if I'm reading a paper in my synthesis and it was published in 2026 or 2025 or 2024, like those very recent years, knowing that it's reflecting what's currently happening. Now, that's not to dismiss the great work that's happened in the past, and it will be great to get seminal papers, seminal concepts, ideas from the past. And you might be able to retrieve that through targeted searches or through expert solicitation. So a combination of, and also backward citation tracking, because a lot of current papers from the last few years will still be referencing important papers from the past. So in a way, it's like kind of leapfrogging back. Instead of doing an exhaustive record search, you get the most recent papers, you look through the references of the reference lists of those recent papers to find papers from the past that could also be that could be useful. So papers from the last 10 years, 20 years, I don't know, 30 years. I am a fan of going in the past. I mean, I love reading like uh, literature from 30, 50 years ago, because I think that it's important to keep that connection. But in a realist synthesis like this, you may not have the luxury of doing that strictly through an exhaustive record search. Um, so those are advantages. Now I want to talk about some disadvantages, because no strategy is perfect, right? And there's always going to be drawbacks, risks, and benefits, right? So three disadvantages. The first is the potential to miss important papers after quotas are filled from the database record library. So using RCQ means that only a portion of the database record library will be screened and the rest will be left unexamined. Therefore, combining the approach with other strategies, for example, backward citation tracking, will help to mitigate the potential loss from not screening the entire database record library. So I've provided a potential solution, but that is something that you would have to address. Now, another reality is if you do a database search and the record library that's retrieved has numbers in the range of, say, 500 to 1,000 records, you might decide to screen all of those records because you are not working with a lot of material. You could screen 1,000 citations. It wouldn't be that long to do that. Where it becomes challenging is when the record library gives you tens of thousands, into the tens of thousands of records. So that's another reason why you might not want to use reverse chronology quota record screening is when your record library is small enough that you can manage to screen it in its entirety. You still may have a problem of how do you deal with so many eligible papers? Even in 1,000 records, what if you have 100 papers that are eligible? Well, in that case, how do you manage that? It's maybe not the most difficult thing, but you still have to figure that out. So, something to constantly kind of think about. The second disadvantage is that the set of papers retained using RCQRS is too diverse to analyze for specific review questions. So the technique will likely capture roughly relevant papers which may be tangentially related to the review questions. Such an approach may not be suitable for the novice realist reviewer or for some reviews in which the focus is very specific and conducting an exhaustive search of the literature may be advantageous. So there may be certain cases when you really are looking for something very, very specific. It's not exploratory. You're looking to understand, you're looking to synthesize the results of primary studies on a specific intervention, and you need to do an exhaustive search for that. And then thirdly, combining RCQRS with expert solicitation may introduce papers which are not relevant or too specific. So if you ask other team members or people in your network to recommend papers, they may be recommending papers that are actually not that useful. They don't have richness. They're showing only one side of the story, or they're just not relevant. So asking experts to recommend papers to supplement the use of RCQRS may mean that experts recommend papers that they prefer, even if they do not align with the goals of the review or do not provide rich insights into the explanatory mechanisms of program efforts. So that's just something to keep in mind. It's not the end of the world. If somebody recommends some papers that are not relevant, you can keep them in your retained set, but rank them low in your appraisal and see if they can be of use at some point as you build your theoretical, platform for your analysis. Those are some disadvantages. And so here's some concluding thoughts, and then we have some time for questions. So so, so RCQRS, reverse chronology quota record screening, is one way to approach the question of screening in realist synthesis. It's particularly suitable for rapid realist reviews and for reviews that are exploratory in nature. And the decision around screening approach affects other stages of the review. And in particular, this strategy allows for more time to analyze the data set, which is needed for the realist approach. And the approach works best when combined with other approaches, such as backward citation tracking and expert solicitation. So those are my concluding thoughts. And there's one paper that you can look at for more information. And yeah, let's open it up for questions. Joe, I can turn it over to you, and we have some time here.
Yeah, yeah, we definitely
Yeah.
do. Thank you so much. So I really appreciate it if everyone can show their love for Justin. You can throw your cameras on. If you're feeling really brave, you can actually clap in real time. You know, we like to clap at the Realist Hub, but everyone's moved over to visual claps apart from me because I'm too old. Yay, Becky's joining. Excellent. Thank you. Right, Justin, I have about 84 million questions I could ask you. So I'm not going to ask all of my questions, but Beth has got one in the chat. We're going to come to that in a minute. Whilst other people are thinking about theirs, I just wanted to, I suppose it was more of a conversation around this. I've had at least three conversations this week with people that are researching very niche areas. And we know because of the novelty of that, there's going to be very little in the way of academic records. So we've already spent a lot of time talking about the need to diversify and look at websites, blogs, be really creative around the grey literature. And then we have spoken about the potential to broaden out. And for instance, a couple of them are around therapeutic approaches, where you know how massive that literature is. So as you were talking, I was thinking, this could be an interesting way for them to see, is there anything relevant in this broader literature set without getting completely overwhelmed with literature that there isn't directly relevant to
Hmm.
their own area, because then they can supplement that with the grey literature, with the websites, the blogs, the stakeholder input. So I can
Hmm.
see that this
Hmm.
could be useful for that. The other thing is, I mean, it's a little bit late. I'm a little bit late to the party, but I think I could have used this in my PhD. So I did a realist evaluation, got to the end of my evaluation, and realized that I needed literature, but I had five distinct areas. If I'd done five realist reviews, I would probably still be sitting here doing my PhD today. So I did very quick and dirty realist inspired reviews of trying to pull some literature together. Again, I can see doing very structured, focused database searches and then using this as a way to explain or to offer greater explanatory, reasoning behind your evaluation results could be a really useful way of approaching that as well. And
Hmm.
there are so many more I could talk to you about.
Hmm.
But
Yeah.
I think this is coping with volumes of data is a challenge for some projects, but equally coping with insufficient data is
Hmm.
also a challenge.
Exactly.
And then
Hmm.
branching out through so it's through the next search, if you like, through that iterative research, iterative researching, going,
Hmm.
okay, there's nothing. I need to broaden out. I have actually recently spoken with someone who's done this around, they have got qualitative papers. The qualitative papers are what I described as surgically interesting. There's no mechanisms in them
Hmm.
at all, which is very unusual for a qualitative paper, as I'm sure you're aware. So there's a lot, even in these qualitative papers, there's lots of context, there's lots of outcomes, but they'd have to abductively generate 90% of the mechanisms, which isn't ideal. So
Hmm.
broadening out, the field's huge and not as relevant, and there are lots of reasons why you wouldn't want to broaden out. So yeah,
Hmm.
I don't know. I
Yeah.
think I've just
Yeah.
like rambled there, but yeah, no, as you can tell, I'm probably quite
Yeah.
excited. So that's quite
Yeah.
good.
Yeah, it's good. I mean, it opens up possibilities. And what's interesting is you could have a you could have an intervention that you're wanting to find literature on, you find very, very, very little. The minute you step one step outside of that
Yeah,
scope, just one step, now you have tens of thousands of options.
yeah,
And then it can overwhelm your, so
yes, totally. Yeah.
what's interesting is you could start with having nothing and then feeling overwhelmed very quickly. And
Yeah,
so
and
again,
and
yeah,
worry that I'm looking at things that aren't relevant. I'm wasting my time, especially when you're on a time pressured project or a
right.
PhD. So
Right.
I think that
Yeah.
comes a lot, quite a lot.
Mhm.
So Faye, do you want to stick your question in the chat and then we'll come to it in turn? But what else did I want to say? Oh yeah. So Justin, if you were going to do as I've just suggested, you start off very narrow, you think there's absolutely nothing in your field, you need to go broader. How would you write up in your method section then the justification of bringing in this method, but only at that particular section? So you go through the standard database searching for like almost phase one, and then this becomes phase two. Would you need to justify that differently to reviewers? I often find reviewers can be a little bit interesting when it comes to realist projects
Hmm.
if they don't have any realist experience.
Well, from the examples that we did, we didn't really have any pushback from peer reviewers in terms of our use of reverse chronology quota screening right from the start. So we didn't say we did, a full scan of the literature to see if we could find
Mm,
papers. We couldn't find any, so we're going back to RCQ. We just started with RCQ, and there was no eyebrows raised from any of the papers published so far. I think um, some small scale kind of explorations of the literature to generally see what is
Yeah,
out there is useful, and then you can make a decision. So I
yeah,
don't think you need to absolutely establish that it's impossible to find anything because, well, the reality is you could do it this way, you could do it that way. But the time factor is also something that is going to be a big question, right? So if you have less time, you have more justification for using the approach. Before we get to questions, Joe, I just realized I just want to
yeah,
share
yeah,
this.
yeah, the appendix. Yeah,
Yeah,
yeah.
this is in the supplementary file to the paper, and this is a checklist that we developed for the approach where if you use the approach, this is a way to justify it. You include this as an appendix in your own report. Quota numbers. So this is like, and again, in this preamble here, we just say this is a totally rough guide and you have to make it your own. There's no rules, but just say, for example, if you're doing a 3-month review, you might think up to 30 papers, 6 months, up to 60 papers. And then so you have number of months for the review, the justification of the number of papers, and then you have quota categories. So you might have categories around context, aspects of the program, study design, so the research papers that your data set might have. You might have, that's another point I want to make is you might have quotas for the types of studies. So you might decide that we want to gather at least 15 reviews. But we want to make sure that the reviews don't dominate. We want primary study literature because, like you said, Joe, some types study designs may not be good for mechanisms and so on. So you could say we want to make sure that we have at least 15 qualitative papers, 10 quantitative papers, so that you're getting representation in that way as well. That's another aspect to it. And so anyway, people can look at this
So the
form
idea
and
is
use it.
there,
Yeah.
Justin, they would delete the bullet points and put in their own rather than leaving the bullet points in. Is that the kind of
Well,
thoughts that you had around that? So they
the
would
bullet
have their own.
they wouldn't delete these. Well, I suppose they could delete them, but these are just meant to be, yeah, you could delete these and then just add your estimates here. And this is where you're supposed to, fill out in this on this column here. But yeah, I suppose I see what you're saying. You probably want to delete that because these are just examples as guides. So they can
Yeah,
modify this form. It's just to say that you can actually make it very transparent as well,
yeah,
Yeah, and that
which is
helps.
always helpful in
Yeah.
realist research,
Yeah.
always.
Okay, sorry.
Right,
Let's go to
so Beth,
questions.
yeah, because Beth's got two questions now, one
Yeah.
embedded within the other, so it might make sense for Beth to come on and you to answer both of them all at the same time. Both of them all at the same time? What a strange way of saying something. Beth, are you there? You're still on mute,
Hi.
or I can't hear you. Can you hear Beth, Justin?
No, Beth, you might need to pull out your headset or yes, I think we can hear you
I
now.
think you might. You've got a blue line round, so I'd say you might be there now. Say hello. No.
Hmm.
So, Justin, maybe
It's
we can
okay.
read
Yeah.
Beth's and then answer it accordingly. Sorry, Beth. Next time,
Y-
maybe.
Yeah, so let me read Beth's so Beth's question is when might quota record screening sorted by relevance be more suitable, if ever? Yeah, that's a really good question. And you could do that. There's nothing objectionable about sorting by relevance and then using a record screening a quota thing where you're saying, okay, we're gonna sort by relevance and go backwards that way. Um, the thing what I find interesting is that when you order in reverse chronology instead of by relevance, you are going to be exposed to a wider range of um, a wider diversity of papers. And that diversity may help you just in exploring. Now, a lot of that diversity is not useful at all because it's way out there. It's just completely irrelevant. But there will also be other papers that actually are relevant, but the relevance sorter didn't pick it up as relevant because the relevance tracker is using an algorithm to determine relevance, whereas you're using your human brain. And so the human brain being creative might pull together some things that wouldn't otherwise be seen. And this is particularly important for really exploratory reviews where you're still trying to figure out what exactly are we looking for here. So that's basically it. But if I think that using relevance is good if you're very, very clear about your scope and there is a clear intervention that you're looking for, and relevance is getting you there. So I wouldn't rule it out. But it's not my first choice, but it's a viable choice. Bess, does that help? Yeah. Um, okay.
And I think from
Joe,
Alan Critter's comment as potentially being covered with you sharing that supplemental file about how you arrive at the right number for the
yeah.
quota screening. Um, Alan Critter, I can't see, I've said that, I can only see like 12 of the things anyway. But if you don't feel like that's being covered, can you just come on and let us know?
Yeah, just I think I missed the starting part, and that's why the confusion. I'll go back to the recording. Just wanted to understand how do you arrive at those numbers of quota? That
Yeah.
would be very helpful if you wanted to add to that.
Yeah, I mean the primary determination is what, in my opinion, the number of months that you have. So it's a very pragmatic strategy. So you basically allow for more papers into your quota as and so with the document that I shared, I had given some examples. I'll just share it again. I'd given some examples here, like for example, the 3 6 month 12, like if you have an 18-month review, imagine that you could synthesize 90 to 120 papers, but if you have less, you might shorten that. And that just makes it gives you a vision of like how big this is going to be. And then you realize that, well, if I do a 6 month review, I would synthesize a shorter number of papers, but that might just be a starting of a number of other reviews that I could do in the future. That's the kind of thing I'm thinking about. Um, and then there's the quota categories as well. So your numbers may be spread out. So if you have multiple categories, you might have less numbers per category and so on based on the number of months. Does that help? Yeah, very good.
Thank you
Okay.
so much.
Okay. Okay, where are we now, Joe? Next
So we've
person
got the
is
next one is from Rebecca Pearson, which is one of my other 84 million things that were floating around in my head.
yeah.
Rebecca, if you want to come on,
Yeah.
which is you can also use this, and I think it's really helpful to develop IPTs and for research teams that don't really know where to start, or perhaps you've got a general area, you want to be able to put a funding bid together. I think this could be a really useful way of trying to
Yeah.
scope out the original literature. And there are some teams who spend an awful amount of time and put an awful lot of investment into
Yeah.
IPTs and can spend months. Others spend a very short period of time. Rebecca, do you want
Yes.
to come on and make sure that we fully answer your question for you? But yes, I could see this could be used in not just in the way that you've explained
Yeah.
today, Justin, but I think it has greater application across the
Yeah.
realist approaches.
Yeah. Yeah, no, I agree, Rebecca, and your comment there really makes sense that you could use it for developing your initial program theories. And grounding your initial program theories in the literature is a great way to do it, right? Of course, we don't want to we also want it to be creative, so we might merge reading papers with our own creative thinking and our team-based, creative discussions to develop the initial program theories. But you're right that you can get quickly into the literature using reverse chronology quota screening, and then at a later stage do a more substantial, exhaustive record screening for the entire literature to test those initial program theories. So that's another way to design it. Yeah.
I think one of the things I like about this, Justin, and the way you've
Yeah.
articulated it is that it is a systematic search still. So you're still
Hmm.
doing it's still taking a systematic approach. We're not sitting there with a cup of coffee and Google Scholar and going on a leapfrog investigation, which is sometimes what
Yeah.
happens when you're trying to just do this as
Right.
initial
Exactly.
exploratory looking. You can then sit down and go, right, okay, so that I can make sure that, and yes, you potentially finding the most recent stuff, but actually that's usually quite helpful as well. Yeah, okay.
Yeah.
I do too go back
Okay.
to the original stuff from, 20, 30 years ago as well. But especially what I'm thinking is could be particular application for funding. I don't
Yeah,
know if you've used it like that because I
absolutely.
know you do get
Yeah.
involved in a lot of funding, but
Yeah.
I don't know if you've used it in that sort of scope to help research teams at
Yeah.
the beginning go, we want to look at this. We don't know exactly, but we
Yes.
want to look at this.
Yeah.
And then part of
Yeah.
your job is to help them narrow down
Yeah.
that research
Yeah,
questions,
yeah,
right? Yeah,
absolutely. And a very good way to add to your funding application is to say we've done a rapid
yeah,
realist synthesis already. So we're already in it, we're already down the line. We already found these things. Here are the gaps, And
yeah,
so and using a very contemporaneous set of literature, very recent, is also very
yeah,
attractive for funders because you're working with the latest
yeah,
things, cutting edge context and so on.
yeah.
Okay,
No, I
let's
agree.
read Valerie's.
So
Valerie says,
Valerie's got a screen on, so she might be able to come in and join that.
yeah. So Valerie says, how do you balance insights gained from sources that aren't rigorous? For example, an interview in lay press that provides causal insights but without evidence for how those insights were obtained versus rigorous empirical research. Well, the realist approach is okay, so that's a really good question. Um, we are we want to transparently report where our sources are from, but we're not going to preclude sources that aren't quote unquote rigorous, because causal explanatory insight is, well, sometimes it's actually richer in the non-empirical areas, right? So sometimes you get a really powerful mechanism that is really makes sense, but it's not funneled through a research process. Sometimes the research process weeds out the richness and gives you like outcomes data in the end without all the process. So not always. Obviously, there's research that embraces the process, the mechanisms, and so on. But there is also the fact that there may be non-empirical sources. So we're not going to preclude them. We will keep them and transparently display where we are sourcing our material to build our CMO configurations, knowing those CMO configurations have to be tested in the future. We have to continually explore them through our research approach. That's my take. Valerie, do you have a follow-up to that, or is that what you were asking? That was good?
Sorry, having trouble
Yeah.
coming off mute. No, that was really helpful. I appreciate that.
Okay. Okay. All right. Okay, good. So Joe, shall we go to
Yeah, so I think Alan Kruger's just saying yes, she's just done 5,000
yes.
papers. I think we all feel
Right.
that pain.
Yeah. Okay, good. I'm glad that maybe you'll find this technique to be useful. Annalisa says, can I ask how funding panels may have received this? Some quite fixated on classic systematic methods. True. Well, what's interesting is that for the most part, that we've used reverse chronology quota screening. We didn't include it in the detail in the funding proposal, or it was a modification that happened after the fact. But I also think that you can justify using this, especially like if you're doing a rapid realist synthesis, or if you're doing a realist synthesis as stage one of a multi-stage project,
Yeah.
where the first stage is to anchor yourself in the literature, but then you will be rigorously testing the theories after the fact. Perhaps the exception to that is if you're applying for a standalone realist synthesis, so you're applying for 18 to 24 months to do a realist synthesis that is just a standalone project, not attached to a realist evaluation or some follow-up realist study, then maybe the exhaustive screening strategy would be more appropriate. But RCQ would be particularly appropriate if it's rapid or say year one of a multi realist study. That would be my take on that.
I also
Yeah.
asked, and I don't know if we've got it yet, Annalisa, like, what's your field? What area are you in? Are you UK based? Because sometimes that can affect systematic reviewers. I know that reviewers in the UK tend to be more generous towards realist methods than they are in other parts of the world. We've certainly had challenges in some of our European studies that I've been involved in. And I hope, I mean, Justin, you've probably got more experience of that than me and the breadth of international literature that you've been involved in. But I would like to think that in time that will get easier as the method becomes more used across the world.
Yeah.
It's
Yeah. Yeah. Yeah, Annalisa. Yeah, well, Annalisa is definitely in the UK, I think, right? Because yes, we met last year in in Bristol. So very good. And then Alankatra, also appreciate the point of including somewhat relevant papers. There's always this subjective decision making. Yes, and so the point here is that instead of really belaboring the decision at screening. So like all the maybes, like you could use a traffic light system in the screening, right? Green is yes. Uh, then you have the yellow is the maybes, and then the red is totally not relevant. And quite often what happens is we have all the greens, and if we have an abundance of greens, then we just ignore the yellows, even though the yellows might actually be giving us the richness, giving some really rich diversity. So reverse chronology quota, what we're doing is greens and yellows are all in. We're looking at exactly matched papers, but also tangentially matched papers up to a quota, and then we synthesize that diversity and see what we get, see what happens. So Faye says, I'm using this in my PhD. It's been brilliant. Okay, great. Okay. And Sarah Jane. Okay. Okay, good. These are good comments. So here I'm at Saul. Okay, I'm reading Saul's question. Very useful. I'm curating an ever-growing pile of literature across different contexts. The more I read, the more citations I find exponentially. This might also be a useful strategy for me to set quotas to manage the citation tracking. Yeah, absolutely. So, having more time to work it through, work your analysis through, this is the interesting thing. Like, if you spend so much time looking for the papers and you only have, like, after all is said and done, you only have, say, 10 weeks to do the analysis, you are going to burn through that analysis and just try to get it done as as best as you can with whatever time you have. But if you have more time, 2 months, 3 months, to sit with the data set, really immerse yourself in that data and see it in different ways. Because when you read the data set holistically and you start to reread and reread the data set and immerse yourself, you can start to see some interesting connections that you might not have seen otherwise. So this is really about managing all of that. Okay, Emma says, are there any considerations for this reverse chronology screening for the non-research evidence? That's a good question. The
I
thing is
suppose
that,
it also means outside of reports, because reports you could date as well. So you're probably looking at that slightly more
yes,
abstract grey literature, aren't you, in that respect?
yes, the only thing with that is that I mean, will you have an index? Will you have an index of that grade literature, or will that come through hand searching or recommendations by experts and just known in the field? So if it comes that way, then it doesn't have to be with reverse chronology quota screening because it's just coming through expert solicitations being recommended by experts. But if you have a database of grade literature, you could order that database in reverse chronology.
Yeah.
Now, in the study we did on care under pressure, when we looked for paramedics, we couldn't fill the quota, the 30 papers in the initial round with the database screens. So we went to the journal. We went to paramedic practice journal, so the British Journal of Paramedic Practice, and another journal. They were both British journals, but they were lesser known journals compared to the nursing journals. But what we did was we used reverse chronology quota for hand searching the journal. So we started with the most recent edition of the journal, and we literally like searched the table of contents for the editions moving backward until we got our 30. And what was really interesting was we did get so many rich papers from hand searching the journal as well.
It's
So
interesting, isn't it?
yeah,
What doesn't come up. Sometimes you can't understand as well when you look at it and you go, this should fit everything. This fits all
yeah,
my criteria, and it just hasn't come up through the
it,
databases.
that's right. Well, we asked our information specialist, and he said that it was because that these journals were not in the index
Indexed. Yeah.
for the databases. So especially in really specific areas, really niche areas, you could go to specialized professional body magazines or
Yeah.
journals, that 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 could give you and just hand search those journals.
Yeah. I
So
sometimes tell people as well to walk the conference halls if they're in a really niche area.
yes,
Just walk
yeah,
looking for the posters, because
yeah,
sometimes there's some interesting stuff to be had there. Emma said she was thinking of blogs and podcasts, which is, I think, potentially
yeah,
a future direction for us in the research world, trying to incorporate
yeah.
that data into our projects, which could be a little bit more challenging.
Yes, that is true. I do have an example of a study we worked on where we did a rapid realist synthesis and we included social media, so Facebook and so on, for healthcare providers who were doing sort of working in a new setting, a new innovation. And there wasn't a lot of like research, empirical research on it, but there were a lot of Facebook groups where the healthcare providers were talking to each other about their challenges and so on. And we use some of that data as well. That doesn't fit with reverse chronology quota because it's not database records that you're screening, but it's supplementary, and you could supplement your reverse chronology quota screening with this non-empirical literature as well.
Well, Justin, we're about like got 2 minutes left. Awesome
Yeah.
timing. That's very
Yeah.
well timed. That's expertly
I think
timed,
so.
as expected. So thank you so much. This has lived up to all my expectations. It's been, as you know, I do get a little bit nerdy about the different methodological approaches to dealing with these realist, well, just realist reviews and realist evaluations, so realist approaches, I suppose. And it has been really, really good. So thank you so
Yeah,
much.
it's been
Really
a
appreciate
pleasure.
it. If you
Yeah,
give
it's
us
been a
a few
pleasure.
days,
Yeah.
up to a week, we'll get
Yeah.
the recording out and it'll be on the website, and we'll push it out on LinkedIn so everyone knows that it's there. But what did I want to say? Yes, I'll be hanging on at the end. I've got a little bit of time today, so if anyone's got any questions they want to ask, something you think I can answer really quickly, rather than you sitting at home stressing like I quite often was during my PhD, if you have any questions, I'm happy to stay on and we can explore some of those. Might need to go and get a drink of water first though. But thank you, Justin.
Yeah.
Enjoy the rest of your day. You're starting your day, we're ending ours.
Yeah.
So have a lovely day. Thank you so much.
Okay. All right. Take care,
Thanks,
everybody.
Ben.
Thank you,
Bye,
Joe. And
everyone.
bye, everybody.